So we know that limited health literacy can be a factor in determining a patient's interaction with the healthcare system, and it can negatively impact their outcomes after surgery. It's been shown to negatively impact patient outcomes in many chronic diseases like diabetes and high blood pressure, and we're just starting to study it in surgical outcomes as well. And early studies have shown that it may lead to longer length of stay after surgery, and it may lead to increased rate of minor complications. In our study, we showed that limited health literacy led to increased rate of infection after surgery, whether that's a surgical site infection or a deep space infection or pneumonia, UTI, C. diff. And it's important to understand that those patients with limited health literacy might be at higher risk for an infection after surgery, so that we can start to understand why and design an intervention and tools to better support those patients in their surgical journey. We did see that our patients with limited health literacy had a median length of stay of 6 days compared to 3 and 4 days for marginal and adequate health literacy patients. So that's a remarkable difference. It just wasn't statistically significant. And I think with continued study, we may find that is contributing to patients' outcomes as well. I think that interacting with the healthcare system is a really unique, and it can be a scary experience. And so I think that as providers, it's our job to almost act like everybody has limited health literacy and try to really engage patients and make sure that they understand, give good detailed explanations using visual cues. A lot of our redesigned patient information has visual components. And I think that it's more our job than the patient's job to communicate whether or not they're understanding.
I think, health literacy, we think about it in 3 phases of understanding. Number 1 is you just have to realize, number 1, that there are many patients out there who have difficulty understanding and using information. And the surgery journey is very confusing. And so many patients have difficulties with that. And that can include my own family members who have trouble figuring out how to take your prep for your colonoscopy, where to show up for an operation. The second part is really the understanding why, patients with limited health literacy have poor outcomes. And that's a lot where research such as ours helps kind of fill those gaps. But obviously the biggest question is, how do you intervene? And, in surgery, we're sort of behind the 8 ball. This has been done over the last 20 years in many other chronic disease models like diabetes, CHF, COPD. In those fields, people have figured out how to put together best practices in health literacy. They use better patient education material. They do better informed consents. They use visual guides to help patients understand why this disease is bad. And then that modifies behaviors and changes the outcomes. So I think the same thing can be done in surgery. And, the beautiful thing about all this is these best practices, they're out there. The government has literally on AHRQ, you go to CDC, they have toolkits that tell you actually what to do to practice good health literacy methods.